This bone review, this learning session will help you help you understand the bony anatomy that you need to understand case 3, the case of the tennis player with pain and unable to serve. In case 1, we looked at the lower limb girdle, the pelvic girdle. It's a girdle adapted for weight transmission from the body to the lower limbs. Whereas the shoulder girdle, which is what we'll be looking at in this learning session, is adapted for mobility rather than stability. Although the hip dislocations are uncommon, shoulder dislocations are fairly common. So not to say that that's what's going on in this case, but it's a very different joint. As we noticed in the knee, one of the important criteria for stability of a joint is the amount of bony congruence, where congruence is the fit between the two ends of the bones meeting at the joint. And again, like the knee, but unlike the hip, we have a relatively flat and shallow surface and fairly small. And this region of the humerus, which we'll review in a minute, fits into it scarcely at all. So unlike the hip, where there is a lot of bony congruence and a lot of reinforcement of that bony congruence, this, in terms of bone structure, is a fairly flimsy joint. The bones of the shoulder girdle are the clavicle, which is here, and the only bony joint between the axial skeleton, the sternum here, and the shoulder girdle is the sternoclavicular joint, which is here. So this is the only bony attachment. This is the clavicle. This is the sternal end. This is the acromial end, which meets the scapula. And these two joints are the only bony attachment between the upper limb girdle and the axial skeleton. If we turn the skeleton around for a minute, you can see the scapula in the back. So it's shaped like a triangle. Here is the spine of the scapula, and that continues around laterally to form the acromion. So the acromion is the highest point of the scapula. If you think about it for a minute, people who are afraid of heights are acrophobes, and the Acropolis is the highest part of Athens. So this is the acromion process, or the highest part of the shoulder. So spine coming all the way across from the vertebral border here and extending laterally as the acromion to meet the clavicle at the sternoclavicular joint. Above the spine is a depression or a fossa where a large rotator cuff muscle will sit, and that will be the supraspinous fossa. Inferior to the scapular spine is another fossa, which sensibly is named the infraspinous fossa. So obviously the scapula is not bolted to the ribs, as this poor skeleton is, and the scapula can slide freely around on the chest wall during all the motions we can do at the shoulder. So a lot of our mobility is enabled by that capacity to raise it, lower it, slide it back, slide it forward, and this is the shoulder joint. The scapula articulates with the humerus, so it looks like it might, and it's hard to tell because of the way this bracket is situated, but the humerus doesn't articulate with the acromion process here. There's actually a gap, and a muscle, which is coming out from the supraspinous fossa, one of the rotator cuff muscles, actually passes through this tight space between the head of the humerus and the acromion of the scapula. Like most long bones, the humerus will have a proximal articular end and a distal articular end and a shaft in between. This will be the head of the humerus, which fits badly into the glenoid of the scapula. And then bumps, one name for a type of bump is tubercle or tuberosity. This is the greater tubercle, and this is the lesser tubercle of the humerus, and the rotator cuff muscles will attach on these two tubercles. So the rotator cuff muscles will be crossing from the scapula to the humerus, and because the bony fit is not very good, because the capsule is relatively lax because there are insufficient reinforcing ligaments there. The muscles of the rotator cuff will be providing a lot of the stability for the joint, and supraspinatus will come through this tight space. That's the anatomy of the proximal humerus. The shaft is here, and I'm going to turn the skeleton again. So the deltoid muscle attaches all along here, along the clavicle, along the spine, and then comes down over the shoulder and attaches here at a bump that's called the deltoid tuberosity. And then if we look right behind that, we can see an indentation on the back of the humeral shaft. Two of the heads of the triceps attach above it and below it, and then passing between those two heads of the triceps is the radial nerve in the radial or spiral groove.